He has done the same thing every morning for 31 years. The alarm goes off at 6:15. He sits up on the edge of the bed, reaches for the glass of water on his nightstand, opens the small plastic organizer with Monday through Sunday printed across the top, and swallows 4 pills in 2 gulps. Then he walks to the kitchen, pours a cup of coffee, drinks it black while standing at the counter, and reads the news on his tablet. By 7 o'clock, he has eaten nothing. His stomach is empty except for medication and caffeine. He has been doing this since he retired. He considers it discipline. His body considers it something else entirely. I am Dr. Arya, and on this channel, Senior Health, I talk about the things that matter most for your body after 60, the things that are not printed on prescription bottles and not mentioned during 8-minute doctor visits. Today I need to talk to you about a morning habit that is so common, so deeply embedded in the daily routines of older adults, that questioning it almost feels absurd. But the research is clear, and after what I have seen in my own practice over the years, I cannot stay quiet about it any longer. The habit is this: waking up, taking your medications immediately, drinking coffee on a completely empty stomach, and not eating a real meal for 1, 2, sometimes 3 hours. If that sounds exactly like your morning, you need to hear what comes next. Let me start with the coffee, because that is where most people will push back first. Coffee itself is not the enemy. There is solid evidence that moderate coffee consumption has real health benefits, even for older adults. Antioxidants, mild cognitive support, even some cardiovascular protection in the right amounts. I am not here to take your coffee away. But when you drink it, and what you drink it with, changes everything about how your body responds, especially after the age of 60. When you wake up in the morning, your body is already in a stressed state, biologically speaking. During the final hours of sleep, your adrenal glands begin releasing cortisol, your primary stress hormone. This is called the cortisol awakening response, and it is a natural process designed to bring you from sleep to full alertness. In a younger person, this system is tightly regulated. Cortisol rises, you wake up, it levels off, and your body stabilizes within the hour. After 60, this regulation becomes less precise. Cortisol levels tend to stay elevated longer. The morning spike is often higher and takes considerably more time to come back down. Your body is already running in a mildly stressed state before your feet even touch the floor. Now you pour coffee into that situation. Caffeine stimulates additional cortisol release. In a younger person, the combined effect is manageable, a slight increase that fades quickly. But in a body over 65, where baseline cortisol is already elevated and the regulatory system is slower to respond, that cup of coffee on an empty stomach creates a cortisol surge that can persist for 2 to 3 hours. And elevated cortisol does something that most people never connect to their morning cup. It raises blood sugar directly. Even if you have eaten nothing, even if there is not a single gram of sugar in your coffee, cortisol signals your liver to release stored glucose into the bloodstream as part of the body's stress response. Your blood sugar rises, your pancreas scrambles to produce insulin, and if you are already dealing with age-related insulin resistance, that glucose stays elevated far longer than it should. This is why some of my patients come in with fasting blood sugar readings that make absolutely no sense to them. They have eaten nothing since the night before. They avoided all sugar. They did everything right, but their morning coffee on an empty stomach triggered a cortisol-driven glucose release that spiked their numbers before they ever sat down to breakfast. They are being quietly betrayed by a routine they believed was completely harmless, but the coffee is only half of this equation. The other half is what sits next to that coffee cup every single morning. The pill organizer. Most adults over 65 take between 4 and 7 medications daily. Many of them take all of their morning medications at the same time, on an empty stomach, washed down with coffee or a small glass of water. And for most of those medications, this is the worst possible way to take them. Let me explain exactly why this matters so much. Certain medications require food for proper absorption. Others require an empty stomach. Some interact with caffeine in ways that either amplify or dangerously diminish their effects. And when you take multiple medications simultaneously on an empty stomach alongside coffee, you are creating a pharmacological environment that your doctor almost certainly did not intend when writing those prescriptions. Blood pressure medications are a perfect example. Many common antihypertensives, particularly ACE inhibitors and calcium channel blockers, are directly affected by caffeine. Coffee can temporarily raise blood pressure by 5 to 15 points, sometimes more in older adults with stiffer arteries. So you are swallowing a pill designed to lower your pressure while simultaneously drinking something that actively raises it. These two forces compete inside your body every single morning, and the result is blood pressure that swings unpredictably rather than staying stable. Your doctor sees your reading in the office at 10 a.m. and thinks the medication is working perfectly. They have no idea what your pressure was doing at 6:30 when the caffeine hit your empty stomach alongside the pill. Thyroid medications, which millions of seniors take daily, are even more sensitive. Levothyroxine specifically requires an empty stomach and at least 30 to 60 minutes before eating or drinking anything other than plain water. Coffee, even black coffee without sugar, reduces thyroid medication absorption by up to 40%. 40%. That means nearly half of the medication you are faithfully taking every morning is passing through your body without doing its job. Your doctor sees your thyroid levels lagging and increases the dose. The higher dose introduces new side effects. And the entire problem could have been solved by simply waiting 1 hour before pouring that first cup. Osteoporosis medications like alendronate follow the same pattern. They must be taken on an empty stomach with plain water, and you must remain upright for at least 30 minutes afterward. Taking them with coffee, taking them while still lying in bed, taking them alongside a handful of other pills, all of these reduce absorption and increase the risk of serious esophageal irritation that can progress to painful ulcers. Now ask yourself honestly, do you take all of your pills at once first thing in the morning? Do you wash them down with coffee or take them and then pour coffee within minutes? Have you ever checked whether any of your specific medications require food, forbid caffeine, or need to be separated from your other pills by at least an hour? Have you ever asked your pharmacist about timing? If you have never had that conversation, you are far from alone. Most people have not. And the consequences accumulate silently over months and years. Medications underperform. Doses get increased unnecessarily. Side effects multiply. And the patient feels progressively worse while technically doing everything they were told to do. Here is what concerns me most as a physician. The combination of cortisol-spiked coffee, improperly absorbed medications, and no food until mid-morning creates a cascade of effects that compound over time. Your blood sugar destabilizes daily. Your blood pressure swings unpredictably. Your thyroid medication underperforms chronically. Your bones are not getting the protection you believe they are. And you feel tired, foggy, and unsteady for the first half of every single day. Not because you are aging, but because your morning routine is quietly undermining every medication in your cabinet. I see this pattern constantly. A patient comes in feeling terrible. Their labs are inconsistent. Their symptoms do not match their medication profile. We go through their daily routine minute by minute, and there it is. Every morning, pills, coffee, no food, for years. We restructure the morning, just the timing, just the sequence, nothing dramatic, and within weeks they feel like a different person. The medication that was not working starts working. The blood sugar that was mysteriously elevated settles down. The dizziness that was blamed on aging quietly disappears. So here is what I want you to do, and none of it is complicated. First, when you wake up, take only the medications that specifically require an empty stomach. Thyroid medication is the most common. Take them with a full glass of plain water, not coffee, not juice. Water. Second, wait at least 60 minutes before drinking coffee. This allows your cortisol awakening response to settle naturally and gives empty stomach medications time to absorb properly without interference. Third, when you do drink coffee, have it with or shortly after a small breakfast, even something modest, a few nuts, a piece of cheese, a boiled egg. The food slows caffeine absorption, blunts the cortisol spike, and stabilizes your blood sugar instead of letting it surge unchecked. Fourth, take your remaining medications with that breakfast unless your doctor has specifically instructed otherwise. Most medications absorb better with food, cause less stomach irritation, and interact less unpredictably when taken in a fed state. Fifth, take your complete medication list to your pharmacist and ask one simple question: should any of these be separated from each other or taken at a different time of day? Pharmacists are trained in drug interactions at a depth that most physicians simply do not have time to address during a standard appointment. A 10-minute conversation could restructure your entire morning in a way that makes every pill in your organizer finally work as it was designed to. These are not dramatic lifestyle changes. They are timing adjustments. You are not giving up coffee. You are not adding new medications. You are not overhauling your diet. You are simply rearranging the order of things you already do every morning so that your body can actually benefit from what you are giving it. This week, I want you to write down your exact morning routine. Every pill, every drink, every minute. Look at it honestly. Then make one single change. Move your coffee back by 60 minutes. See how you feel after 7 days. I have watched that one adjustment transform how patients feel for the entire rest of their day, and I believe it can do the same for you. If this made you rethink your morning, share it with someone who takes their pills with coffee every single day. They need to hear this. And subscribe to this channel, because next week we are going to talk about the 3 gentle stretches every person over 65 should do before getting out of bed, and why those first 90 seconds of your morning may be the most dangerous moment in your day if you are not preparing your body properly. Everything I have shared today is based on current pharmacological research and my clinical experience, but it is general health education, not personal medical advice. Your medications, your conditions, and your body are unique. Use what you have learned here to start a better conversation with your doctor and your pharmacist. That partnership is where your health finds its strongest foundation. Take care of yourselves. I will see you next week.